Patients and Scid, a rare but incredibly severe genetic immunodeficiency, impairs the production of functional T cells as well as frequently B cells and natural killer cells.
Children with Scid are unable to fight infection because these cells are necessary for adaptive immunity. As a result, they frequently experience persistent pneumonia, diarrhea, fungal infection, and failure to thrive.
This graph shows that babies have a strong early immune system and it gets worse with age, according to Lee, Jong-Cook, and Tang. So it's very important to have an immune system at an early age. And unfortunately, people with SCID don't have that. David Vetter is also known as a boy in the bubble, an example of this. He spent almost his whole childhood in a sterile chamber to prevent fatal infectious diseases because of SCID. His story highlights the devastating nature of SCID prior to contemporary therapies. Children with this illness now have a much better prognosis thanks to development of stem cell research. This graph shows how many incidents of SCID there were out of 1,000 people in Kazakhstan throughout the years 2009 to 2023.
Multipotent hematopoietic stem cells. The bone marrow contains numerous hematopoietic stem cells which have the ability to self-restore or self-renew and differentiate into all major blood and immune cell types, including red blood cells, T cells, B cells, natural killer cells, and macrophages. Despite being limited to the immune system and blood, these stem cells are essential because they serve as the immune system source. Clinical can rebuild immune function from the ground up by replacing or repairing these cells because Scid arises when a child's own stem cells fail to produce functional lymphocytes. Because of this, the multipotent hematopoietic stem cells are essential to almost all Scid treatment approaches. Hematopoietic stem cell transplantation is the first significant advancement for treating Scid. Step 1 is to find a compatible donor, typically a sibling, and remove healthy multipotent hematopoietic stem cells from their blood or bone marrow. To prepare the bone marrow for new stem cells, conditioning therapy is administered to the transplant recipient. Gene therapy is the second most important advancement that uses the patient's own stem cells to fix the genetic mutation in a human body. In a controlled laboratory setting, doctors first harvest the child's hematopoietic stem cells and use viral vector to repair the damaged gene. The immune system is restored with cells that carry the functional form of gene following the fusion of the corrected stem cells. One successful gene correction can result in long-lasting immune restoration because hematopoietic stem cells are self-renewing. In diseases like ADI Scid, gene therapy has demonstrated promising long-term outcomes with numerous children attaining stable immune function.
Stem cell treatments for SCID raise important ethical questions, and the first one is a positive impact is right to life. Beneficence and the right to life are strongly supported by the use of stem cells in treating SCID. Before the development of hematopoietic stem cell transplantation and gene therapy, SCID was almost always fatal in early childhood. Today, these treatments allow children to survive and develop into healthy adults. Clinical evidence shows that early intervention significantly improves survival and immune recovery, making these therapies ethically essential. The second ethical benefit is the improvement in human dignity and quality of life. In the past, children with SCID lived extremely restricted lives, as shown by the case of David Vetter, known as a boy in a bubble. And today, successful HCST or gene therapy allow children to attend school, play freely, and fully participate in daily life. Research shows that children who achieve immune reconstruction experience significantly improvements in social, emotional, and developmental well-being. By restoring immune function, these treatments restore independence, dignity, and health.
However, there is a drawback. Despite these advantages, not everybody can have an access to SCID treatments. Gene therapy and HICT require highly skilled clinical specialized medical facilities and cutting-edge equipment resources that are frequently only accessible in wealthy nations, according to Con 2019. Because of this, children born in environments with limited resources might not have access to life-saving care. In conclusion, stem cell-based advancements have improved the prognosis for kids with SCID. Gene therapy offers potential alternative for kids without compatible donors, while HICT offers proven treatments.